You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
You're listening to Question of the Day on Simple Health Radio. I am your host, Dr. Emron. Thank you so much for joining me on today's episode. We had a question that was submitted by a listener regarding a vaccination. The listener was from California, and he asked, I've heard on the news that there's a hepatitis outbreak. Should I be vaccinated against it? And I thought that was a great question because we do oftentimes see on the news and on social media information about various diseases and illnesses. The outbreak that this gentleman was referring to was actually regarding hepatitis A. So we'll talk a little bit about hepatitis A and the vaccinations that are available to prevent it. Now, the outbreak that I believe he was referring to began in March of 2017. So hepatitis A started off as a small cluster of people who were ill with symptoms that looked like the stomach flu. So they had a lot of vomiting, diarrhea, and other symptoms began showing up like jaundice and liver failure. Hepatitis means infection or inflammation of the liver. And hepatitis A is one of the ways that we can diagnose and identify that particular cause. Since 2016, when all of this began tracking over the nationwide databases, we call that the MMWR, which is handled by the CDC, over 15,000 people were diagnosed with hepatitis A, over half of them were hospitalized, and over 150 people died from hepatitis A. Now, the people who contracted this, they were in two separate groups. One group was a large population of homeless individuals, so people who lived in communities that already have very low resources. They were living in outdoor areas, sharing common spaces, eating foods, whatever things that were available. So the hepatitis A outbreak was linked with homelessness. But there's other outbreaks that happen periodically throughout the country, especially in areas like daycare centers, prisons, and in other populations that are at high risk as well. So hepatitis A is a virus. It goes into the body and infects the liver. It causes swelling and inflammation, and then it leads to nausea, vomiting, diarrhea, and jaundice. The problem is that hepatitis A is typically a mild illness for most people, but if they have any underlying health issues or if they're very young or immunocompromised, then they have a high risk of being hospitalized and possibly death. Now, in the United States, we give the hepatitis A vaccine to children, usually at the 1-year-old checkup. So when they turn 12 months old, they'll go in for their well-child visit, they'll receive the hepatitis A vaccine, and they're protected for life. So even if they're exposed at a daycare center or in preschool or in the community, they're going to be fine, typically. The dilemma is that some parents withhold the hepatitis A vaccine, so those children are unprotected. And then later in life, for example, when they go off to high school or college or they're adults and they get exposed to hepatitis A, they can become very, very ill. Now, hepatitis A can also be spread among people at a restaurant or at a picnic or in other areas where people are in close quarters. So you can't always look at someone and assume they have hepatitis A. They can spread the virus when it's highly contagious, and then later on, other people who were exposed are now going to become very, very ill. Now, fortunately, the hepatitis A vaccine is safe, and it can be given to adults, especially if they've been exposed to hepatitis A. So, for example, people who use drugs, people who are homeless, people who are in jail, people who have intercourse with other individuals, those people are at higher risk of developing hepatitis A, and those people can be vaccinated. So it's a very safe vaccine, and I highly recommend it. Most clinics, primary care centers will have that. You can also check with your health department to see if you need it. Now, there's one other group of people that I do recommend also get the hepatitis A vaccine. Those are people who are traveling to foreign countries. So if you're going to Mexico or Europe or Asia or Africa, in those areas, they have a very high prevalence of hepatitis as well. So if you're going to be eating foods at restaurants, if you're going to a cruise or someplace out of the country, I would recommend getting the hepatitis A vaccine before you leave because you don't want that to ruin your trip. You're going to be very miserable if you have nausea, vomiting, diarrhea, jaundice, and dehydration. And as I said, some people will be hospitalized and actually die from hepatitis A. So I'm glad that this listener from California sent in the question. I will link on the show notes the information information that the CDC has provided to us, along with some other information about hepatitis A. If you have some questions that you would like me to answer on a future episode, just connect with us on our social media. We have Twitter, Facebook, LinkedIn, and Instagram. You can send me a private message. You can even record your question and send it to me, and I'll be sure to include that on the next episode. And you can always visit our website, simplehealthradio.com.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.